So to give a brief background, I'll do a brief presentation followed by Dr. Santosh Krileti, and then we will open it up to our panelists to share their views. And we will keep adequate time at the end. We really want to hear questions that come in from the audience. So please do think about the questions that you have in mind. May I request for my presentation to be uploaded? Yeah, I'm sorry, the panelists will have to turn. It's very brief. So may I have the next slide, please? Sure, Lisa. Sure. So really reflecting on, is there a need to change, and really what is the case we want to make on why we need to change the current status quo. And I want to start by showing you a very brief video. May I have the next slide and can keep later with you.
So once we've assessed and we've asked what matters, we need to go a little bit deeper to really understand some of the impediments to joy, which again can vary by context. So here's some of the things that you might find. Some barriers to joy might include concerns about your physical safety. We know that healthcare workers, particularly nurses, have very high rates of acute and chronic musculoskeletal injuries, high exposures to bloodborne pathogens and other infections. And across the nation, we're seeing increased incidences of unnecessary and unfortunate gun violence. So are any of these physical threats an issue in your environment? When somebody leaves at the end of their shift and it's dark and they're walking to their car, do they feel safe? And do they feel like adequate precautions have been taken to protect them? Psychological safety. Do people feel safe to ask questions, to speak up, to admit that they've made a mistake? Are people safe from bullying or harassment? We'd like to think that that doesn't happen in healthcare settings, but I know some of us have witnessed that. Equity. Do people feel that their work environment is fair and just? And that could be anything from equal pay, to promotions, but also just feeling like their voice is heard as much as the person next to them. Camaraderie. Do people feel like they're part of a team, part of something bigger? Do people feel like they have some choice in how they execute on their daily responsibilities? And ultimately, do people have meaning in their work? Do they feel connected to that higher purpose? So as Derek pointed out, the relationship to Maslow's hierarchy of needs, others have plotted these against that hierarchy. And what this reminds us is that the things at that base of the pyramid, sometimes that represents first things first. And so if we don't first attend to things like physical and psychological safety, we may now be able to help people get to connections.
Using that video as a spark to this discussion that we want to do, as a provocation to this discussion. I'm a healthcare professional myself. I'm a pediatrician, and I've been on all the sides as a medical student, as a young resident doctor, as a treating consultant physician, but also on the other side as a patient and as a family member. And really, if the healthcare workforce themselves are not filled and have enough to give, it's very difficult for them to give to their patients or to their healthcare providers. And as a part of a healthcare team, and I do not know how many healthcare providers are in the audience, but you would agree that if we have a show of hands, how many of you currently work as a healthcare professional? There are just a few, maybe 4, 5. Yeah, few more. So we would love to hear your experiences when we open it up to the audience. But I have also felt at different points in my career feeling marginalized and consistently not able to speak up and not feeling safe to speak up, whether I want to voice a concern or if I want to even admit a mistake that I had made. Physician rates of depression at an alarmingly high rate of 39%. And 20 to 30% of primary care nurses have said that they have emotional exhaustion. So these are very alarming statistics. Last year, the National Medical Commission actually did a survey of 50,000 healthcare providers. This is after the horrifying incident that happened in RG Kar Hospital in Kolkata. And as a part of the survey, I'm just showing you one sliver of that data. So when they spoke with postgraduate medical residents in India, they found that 84% of them reported that they had moderate to high levels of stress. And they said 64% said that their workload significantly affects their mental health. And very alarmingly, 1 in 3 said that we had suicidal ideation within the last 12 months before the survey was conducted. And while we know that the National Task Force recommends a work week of 74 hours per week, which is to contain the number of hours healthcare workers work, this is still quite substantially higher than what we see in other professions. And recently, when we had COVID, it really exacerbated this problem, which was always lie under the water. So we only saw the tip of the iceberg with the pandemic. And we found a lot of evidence that came out with people reporting emotional exhaustion, increased mental distancing from our feelings, and even attitudes of negativity related to our job, and reduced feelings of personal accomplishment. So reflecting back on the Maslow's hierarchy of needs as we saw in the video, really first things come first. We really need to make sure that the physiological needs, adequate rest, sleep, food, that needs to be taken first. Secondly, we need to be physically and psychologically safe in the environment where we are working. Third, we need to have the culture where we have teamwork and camaraderie, where there is a feeling of belonging within the healthcare system. And that eventually will then lead to self-esteem. And only after that will we be able to have self-actualization and do everything that is required for our patients. It's going to be very difficult to ask healthcare workers to do more when they themselves may not have enough to give to their patients. I actually wanted to start the panel discussion with this provocation, but I just also want to very briefly also bring in a little bit of hope that there is a hope on how we can solve for this. And then we will, in the panel discussion, contextualize this to the Indian context and see what the experiences are. So I very briefly want to introduce IHI's framework for joy in work, where there are 4 steps where they actually start with what matters to you conversation. Speaking with staff and really understanding, local to their context, what are the pebbles in their shoes, what are the barriers to joy, and then use those impediments and the information around that to really work with leadership at all levels to have a commitment to addressing those barriers and then systematically using the science of improvement to address them in a systematic way. And this is just a very brief overview, and during the panel, there will be questions and we will be hearing more from our panelists about that. But this joy in work framework really looks at 9 key elements, and there's a lot of literature that's gone into why these 9 key drivers are being selected. And they include some of the things that you've already heard. How do we create an environment which creates physical and psychological safety? How do we get healthcare workers to reconnect with meaning and purpose in their work? How do we give them more choice and autonomy in how they're functioning? How do we have more participative management and recognition of the work that is being done? How do we imbibe a culture of camaraderie and teamwork? And also, how do we really measure it? Can we measure burnout? Can we measure well-being? Is this something that's an important indicator? And then how can we use that information for daily improvement and really support our frontline workers to have wellness and resilience?